Do you have pain that is chronic? Do you suffer from weakness? Do you have fatigue? You feel tired all the time. Even though you've rested, even though you had great rest, you feel tired throughout the day, regardless of what you do. Do you have memory loss? Do you have sleep loss, like insomnia? You can't really go to sleep. And do you have mood changes? Well, so a lot of these symptoms, if you put them all together, are common symptoms found in fibromyalgia patients. And today I'm going to talk to you about fibromyalgia, the condition that really is plaguing, is an epidemic, and is affecting a lot of people in our world. And it's a very real condition. Unfortunately, a lot of our medical specialists, our healthcare specialists, really don't have an understanding of the cause of fibromyalgia. They understand the condition, but they don't understand what causes the problem. Now, I've seen a lot of patients that had fibromyalgia problems, and in my history with them, I find a very common thing that shows up every single time I ask them, questions about their history, their medical history, and they tell me that they've been in a very serious car accident that, immediately after, they'll feel some type of, onset of these symptoms I mentioned earlier with musculoskeletal pain, weakness, fatigue, sleep loss. All those things come almost instantaneously. And then some cases where they, it takes maybe a few years later down the road when they start feeling the actual after effects of the trauma. And a lot of times these type of traumas are from car accidents, especially from whiplash car accidents, where you get hit from behind, your neck does this, or even side impacts can do that as well. And that knocks off, the vertebra in the neck that can limit really how the brain talks to the body. And of course, concussions. If you had concussions from sports injuries or just slip and falls, these traumatic events can have a causative effect on a condition like fibromyalgia. Now, fibromyalgia is all-encompassing. If you break down the word and you look up the word, fibromyalgia is literally, it means pain or of the fibrous tissues, or really it's inflammation of all the fibrous tissues in the body. And so what causes this inflammation to actually get triggered and it doesn't even turn off? Just like a light switch, when you turn it on, you should be able to turn it off. But for some reason with fibromyalgia patients, this is chronic pain, musculoskeletal pain, loss of strength, and sleeping problems, all are chronic and they don't stop. They're just continuous. And some people with fibromyalgia have it lifelong, and it's really debilitating. You can't focus, you can't function, you can't really work, and it's really something that is detrimental to really the quality of life for many people that suffer from this condition. And one option, of course, is to take conventional pain medications. Unfortunately, with painkillers or pain relievers, such as opioids, they're very addictive, and so when you take them, for some people they want more of it, and unfortunately with pain medications, they also have an adverse effect potentially on the liver and kidney if you overuse them. And really the idea is with painkillers and pain meds, they're only really masking the problem, not really addressing the underlying reason why the inflammation is there in the first place. And from my understanding, from my standpoint as an upper cervical chiropractic specialist, I focus on the brainstem. Now, the reason why I do that is because the brainstem is an area in your neck that red area that has a special neurological tract that controls and regulates inflammation. So if there's pressure on that area, let's say if there's a bone that's slipped out of alignment due to some type of trauma, it actually will cause that area to be more hyperstimulated. And so your body actually becomes more hypersensitive to sensations or even pain. So even if you had a little small pinprick on your finger here, the brainstem itself will actually interpret that pain to be 4 or 5 times fold the actual sensation, and so you get more pain than really so in other words, your brain perceives the pain at an amplified level, and that's definitely not something that and unfortunately this particular switch stays on for some people for the rest of their life. And it, like I mentioned earlier, it's debilitating for a lot of people who have this particular challenge. So really my suggestion is to really get checked to see if you have some type of nerve interference or nerve irritation to that area due to a bony misalignment caused by some type of trauma. And if you're interested, feel free to call our office. My phone number is area code 213-385-3858, or you can reach us at our website. It's Doctors Truong, doctor spelled out, and my last name is Truong.com, and you can learn more about or schedule a complimentary consult to really learn more about whether you have some type of misalignment that's triggering this inflammatory cascade that ultimately can consume your life. So thank you for listening to my talk about fibromyalgia. Hopefully this information was helpful to you, and also I want to give you really an opportunity to know that there is a possible solution to your challenge if you have fibromyalgia or your loved one has fibromyalgia, and really to get checked. That's all I'm asking, is really to consider getting checked for this particular challenge, so that we can turn off that switch, so that the inflammation can calm down, and then you can actually experience more of a normal tone and normal life, and really enjoy life better, because you don't have to live in pain anymore. Thank you so much.